All right, we start with the chapter 10. Let's continue with the chapter 9, so-called multiple resources. This time we're going to use, instead of using multiple resources in the same server, we're going to actually using multiple servers. And so let's look at the previous example we had. Previous example we have 9.4 is we modeled everything one server with the 4 resources. And we also noticed that if we have the breakdown logic, actually if the breakdown happened or the interrupt happened and the entire server goes down, entire 4 doctors in there are actually out, cannot be serving anything. So we're going to make some modification on this case and make it a little bit. Instead, we're going to model the exam room as 4 different doctors, as the presentation has. What we have now, we have one room as in charge is Dr. Allen, Dr. Baker, Dr. Charles, and Dr. Duke. Actually, each represent a separate room. And the patient can come in to each one of those rooms. And this is an easy change. All we have to do is duplicate the exam room we had before, exactly the same, and just changing the capacity to 1 for each room. So now represents 4 distinct rooms, and then we link putting a so-called decision node right here and transfer node, and we can call it I talk about this later on why we call it decision node. So then link this transfer node to each one of this exam room, and then we chain their output together, forward the patient into the billing clerk, and so on and so forth. Couple things we notice in this process, and this one thing we fix now. The value itself is only affect one room and one room only, and however so that means if one doctor answers the phone for consulting purpose, only that room goes out and the other 3 rooms still available. But I want you to look at this is the patient is randomly choosing one of the room to line up. Another things we don't feel is realistic is actually there are patients queue up in front of the room. This is not happening in the real setting, and patients not going to wait in front of the exam room. Instead, they're usually waiting in the so-called common waiting room. And so these 2 things we need to fix. So here we stop the simulation a little bit, go to the presentation. What we need to do is these are the information like before. So here what we're trying to do is we're going to route patients into a different physician. We learned this before in the previous example. We're going to make a list of the candidate rooms, and then we're going to select. In the routing logic for this decision node, we're going to choose which room we're going to go based on certain condition. And what we want to try to do is which room has the lowest load, and then we send a patient down there. And also, pay attention to the select condition, meaning if the room is actually during the interruption, meaning the doctors in there are currently answering the phone call, so we don't send patient that way. So the selection condition is a condition you can send the patient down that route. And here in front of them will have a negative sign, which is if the room is valid. If it's not valid, then I send the patient down. But the choosing of alternative based on the so-called associated station load, meaning whoever has the lower load. I may illustrate this, how this is going to be done. This is real quick. We're going to add a list we're going to call this is a no list actually, and we'll call it list of a provider. And the first one is going to Dr. Allen, second goes to Dr. Becker, third goes to Charles, and fourth goes to the Dr. Duke. So these are the four choice of, and no, so pay attention, this particular list I'm adding, this is going to the candidate node. So we adding which node we're going to go to. So actually the input buffer of Dr. Allen's room, Dr. Baker's room, Dr. Charles' room, Dr. Duke's room, and so on and so forth. And this, in this decision node, what we're trying to do is we're trying to select, look at the routing logic. Instead of any, I'm going to choose, sorry, instead of continue, I'm going to choose from the list, okay, and list name is the list of a provider. I'm going to using the smallest value first, and the select condition. Okay, sorry. And here I'm using the smallest value first, and the expression is actually the station's low, and candidate knows which candidate node on the list actually for the node and associate student associate station overload. And then also the select condition we would like to use is first, we call it candidate server, all the server we are candidate to go into, and value and active. Okay, but I want it to be non-value. If it's non-value, then I set it in. So this is the difference between the select expression and select condition. Select expression means based on every single input node from this list, we choose the smallest value who has the smallest load. But select condition is how if you not satisfy this condition, it will not send the patient down that route. Okay, so this is very easy. Let's take a look how we're going to run this. Okay, I made it slightly change. Instead of doing overload, associate station overload, I'm using associate station load actually to minimize the load, taking the minimum load, and it will let the patient send down to the smallest. Let me run this again for you. See that, and it will equally send it patients to each one of the room. And this is finishing up with the section 10.1 and 10.2. I conclude these two sections for now, and we continue later on for section 3 and 4.